Sad news at the marathon yesterday. An Afghanistan war veteran died after collapsing, I think 3 miles from the finish line. His name's Captain David Seath. He was only 31. It's believed he had a cardiac arrest and then later died in the hospital. Seath had been running to raise money for Help for Heroes and raised nearly £700 before the race. So very sad news, really shocking for a man who we're told was extremely fit and was very young, just 31. So how risky is it to run these long distances, and are we all putting ourselves in some sort of danger if we're out running? If a guy that's that fit and healthy and young and trained can fall foul of a marathon. Let's speak now to an expert, Dr. Iqbal Malik, who is a cardiologist, to get some more insight on this. Hello, Dr. Malik.
Good afternoon. How are you?
I'm fine, thanks. Thanks for joining us. So this is shocking to anyone who runs. Now, I've never attempted a marathon, but I go out and do the odd 5K when I can find the time through the week, and I would wager, as a 41-year-old, I'm not nearly as fit as this Afghanistan veteran who was only 31. So how do things like this happen?
It is a really unfortunate event, and it's not the first time something like this has happened. So my condolences certainly go to his family and those of the other people that have unfortunately suddenly died unexpectedly. There are several ways it can happen. The first of them is that he may have had an unknown cardiac abnormality. Now, if that is the case, then would have been picked up had he had some ECGs and tracing of the heart or an echocardiogram. And given he was in the army, he may well have been fully tested at that time. So I think that's unlikely to have been the situation. But of course, if you have a known cardiac condition or one that runs in your family, then you need to have a very detailed assessment before taking up exercise. If we assume that he doesn't have that, then you can have electrolyte abnormalities. You get very dehydrated, the salt levels change, and that can make rhythm disturbances more common. And of course, it may be that, I'm not sure whether he was or not, but some athletes take supplements, and although they're available over the counter on the internet, that can sometimes make you more prone to rhythm disturbances. So I know that a couple of years ago there was a death in the marathon, and it was linked to a supplement of food which was known to cause increased risk. But unfortunately, we have had many cases also where extreme exercise has led to a death in perfectly healthy people with no obvious cause.
We're told that it's on average one death a year at the London Marathon. I mean, obviously, you know, there's so many people who take part, but do you feel that people who embark upon these like long runs have enough information about preparing themselves physically and about checking themselves out for, you know, abnormalities and so forth?
I think they do. I think the London Marathon is 35,000 runners, and it's been going for over 35 years. So I think they're pretty well organised in giving information to people. And of course, there are a number of people who don't run it fast, but run it for fun. And I think they don't put themselves at a terrible risk if they've done their training properly. I suspect, although I don't know, this chap was probably pretty fit anyway. He'd been doing exercise regularly, and for some reason on this day, the heart rhythm has decided to go mad and cause him to have a cardiac arrest.
So what you're saying is there's not really much we can learn from this in terms of legislating for these sort of things, because it really is, you know, a freak occurrence.
I think that is right, and in fact there was a recent piece in the British Medical Journal trying to review whether screening before exercise was useful or not. The only place in the world where it's been shown in elite athletes to be useful is in Italy, and that was from a study many years ago, which unfortunately hasn't been reproduced anywhere else in the world. So either Italy's special or the study was done in a funny way, but certainly there is no general policy for screening with even basic tests like an ECG prior to taking on competitive sport.
Okay, Dr. Iqbal Malik, thank you ever so much for joining us this afternoon.
My pleasure.